This study was conducted to test the relationship between obese children and self-esteem. A total of 2,813 Australian students took part in the study. The method used for eliciting information was different than most self-esteem assessments. Each question presented two contrasting statements. For example, some kids find it hard to make friends, but other kids find it pretty easy to make friends. This format permits an analysis of the number of respondents who identify with a positive or negative statement relevant to that domain, making it possible to evaluate those with low perceived self-competency. It was hypothesized that obese children would have lower self-confidence in some but not all of the domains. Low appearance and athletic competence would be common to both obese girls and boys. In addition, body dissatisfaction would account for some but not all of the relationship between obesity and low perceived self-confidence. A random sampling technique was used to select schools of primary school children. The participants ranged from children with white, Asian, North African, and Middle East backgrounds. Body height and weight were measured, as well as self-esteem, body shape perception, and socioeconomic status. The self-perception profile for children had 36 items and evaluated their perceived competence in 5 domains. The 5 domains include academic, social acceptance, athletic competence, physical appearance, and behavioral conduct. Body shape perception was tested from 9 figure scales ranging from thin to fat body shapes. Participants made 2 choices: current perceived body and ideal body shape. Body dissatisfaction was the difference between the two, so that a negative value was a thinner ideal than current shape. In the sample of boys, those who were obese scored significantly lower than their normal weight peers on athletic competence, physical appearance, and global self-worth. The impact on perceived self-confidence in obese girls was more profound. They differed significantly from their normal weight peers in social acceptance, athletic competence, physical appearance, and global self-worth. For body dissatisfaction, 54% chose an ideal shape thinner than their current shape. Of the obese children, 91% of boys and 96% of girls chose an ideal body shape that was thinner than their current perception. This study shows that even by age 11, obesity has a clear and measurable impact on self-esteem. Obese 11-year-olds were between 2 and 4 times more likely than their normal weight peers to have definably low domain competence or low global self-worth. Most overweight children do not differ from normal weight peers in object control skills, but are inferior in locomotor skills such as hopping, jumping, and running. Reasons for this can be due to the negative attitude of some teachers, as well as the potential embarrassment factor brought out by their peers. The greater risk of perceived low social acceptance in girls might be expected, especially given the stigma associated with obesity and the social rejection attached to ratings of fat body shapes. The article points out that at the end of a summer weight loss camp and an inpatient treatment program, physical appearance and self-esteem greatly improved. There is little evidence that obesity has an impact on early academic achievement in mainstream schooling or of any association with poor behavior at this age. The question is, why are some but not all obese children having low perceived competency? Social factors and family support are important to understanding vulnerability to children's distress. The research indicates that a supportive family environment may be important. For example, it has been noted in Mexico that parents value child fatness as a sign of health, and food treats are indicative of parents caring. It is interesting, therefore, that obese junior school-aged children from Mexican families were indistinguishable from their normal weight peers in self-esteem and other psychological or social outcomes. From this study, we can see how obesity has a large impact on self-perception of children entering adolescence, especially in girls.